Good morning, friends. Today we will discuss about one more interesting bone. So, given bone is humerus. Okay. Now, first we will see about anatomical position of this bone. So, in the humerus, we are getting upper end, shaft, and lower end. So, when we are uh, talking about anatomical position, so this rounded upper end should hold superiorly and broad expanded head remain inferiorly. Then this rounded head rounded head should come medial side. Okay, and this lesser tubercle remain anteriorly. Now we will discuss about features of upper end. So this is a smooth rounded spherical structure is the head of humerus. This is narrow part which separate head from rest of the upper part. This narrow part is called as neck of humerus. Then there are two things we are getting, two tubercles we are getting in upper end. First one is greater tubercle and this is lesser tubercle. Okay, so between greater and lesser tubercle there is a groove called as bicipital groove. Now the upper end is separated from rest of the humerus. This narrow part is called as surgical neck of humerus, and this is commonest site of fracture. Okay, now we are coming towards the shaft. So shaft is rounded in upper part and triangular in lower part. So borders are prominently seen in the lower part of the shaft. Okay. Then on lateral side we are getting tuberosity called as deltoid tuberosity. Okay. Now we will discuss about the features of lower part. In lower part, we are getting medial epicondyle towards medial side and lateral epicondyle towards the lateral side. Then pulley-like structure present medial side called as trochlea, and rounded elevation is present on lateral side called as capitulum. One fossa is present above the trochlea called as coronoid fossa, and one fossa present above the capitulum is called as radial fossa. This coronoid fossa will going to articulate with the coronoid process of ulna at full flexion, and this radial fossa will articulate with the head of radius at the time of full flexion. Now, when we turn it back, we are getting largest fossa present called as olecranon fossa, which will going to articulate with the olecranon process of ulna. So, when we hold this bone in anatomical position, head will lie in medial side, then olecranon fossa will lie on posterior side, and this lesser tubercle will lie anteriorly. Okay, so these are the features of humerus. Okay, thank you.